all the participants had faced discrimination in the health and social service system, identity disrespected, blocking of access to gender-affirming surgeries, doctors who wanted to discontinue hormones, mistreatment in long-term care.
Hello, welcome to the Life Research Institute, an institute that promotes healthy living and healthy aging across the lifespan. Today, we are so honored to have Dr. Marjorie Silverman with us. Dr. Silverman holds a PhD in social work from McGill University, and she is a full professor in the School of Social Work at the University of Ottawa. With a background in clinical practice and grounded in critical social gerontology, her research addresses the complexity of aging, care, and identity through qualitative research. Her work explores themes such as family caregiving, dementia, the sociology of the body, and more recently, trans and gender studies. Welcome, Dr. Silverman. Thank you so much for being here with us.
Thank you so much for having me. It's a pleasure to be here.
I was wondering if you could tell us a little bit about your background and how you got or ventured yourself into this research program within the field of gerontology.
Life trajectories are quite funny. I would say that I landed in the field of gerontology a bit accidentally. In my 20s, I was training to be a psychotherapist, in fact. And while I was doing that program, I needed a job just to, pay the bills. And I ended up working at a health and social service center that happened to specialize in programs for older adults. Through that work, I realized I really enjoyed working with older people. And a few years later, when I decided that I wanted to pursue a PhD, I chose the social work program at McGill and did my dissertation on a topic that was linked to family carers of older adults. That PhD then led me into academia, and I've been a professor at the University of Ottawa since 2013 in the School of Social Work.
Tell us a little bit about some of the recent research projects that you've been involved in.
My main research over the past 5 years was to explore the lived experiences of trans and non-binary older adults with dementia, as well as their carers. This research was conducted from an intersectional perspective that is both anti-ageist and also trans-affirmative. I conducted this research with my colleague in the School of Social Work, Alexandre Barry. Alexandre was the one who really brought the trans studies expertise as well as the disability studies expertise to this project. I brought more of the gerontological expertise, but it definitely had some challenges. For example, it was very challenging to recruit participants, especially during the pandemic. We ended up reaching out to over 1,600 organizations in Canada, and we still only ended up with a very small sample size. Our sample size was small because it is a difficult population to reach. Many are not out publicly, many are not connected to the trans community, and many are not seeking out health and social services due to very real fears of discrimination, and many don't have access to technologies.
It's not research that we tend to hear about commonly. Would you say that it's kind of a new area to concentrate the research on the lived experience of trans and non-binary older adults with dementia?
Yes, at the time that we started this project in 2019, there was a little bit of existing literature on LGBTQ aging more generally, but very little on trans older people and even less on trans older people living with dementia. The interviews that we conducted were innovative and groundbreaking. We published 5 scientific articles throughout the course of the project, all of which we also translated into French, so they're available bilingually. This really created a small base of knowledge that helped to open the field of trans gerontology in Canada.
Wondering if you would be comfortable sharing some of your recent findings, like what have you been seeing as a different lived experience amongst trans and non-binary people living with dementia?
People living with dementia, whether they be cis or trans, are often invalidated and delegitimized and discredited as as knowledgeable subjects and decision makers. And in the case of trans people, this invalidation unfortunately extends to their gender identity. Our participants reported that others took them and their gender identity less seriously, and that was reported unfortunately by everyone in our study. All the participants had faced discrimination in the health and social service system, identity disrespected, blocking of access to gender-affirming surgeries, doctors who wanted to discontinue hormones, mistreatment in long-term care. As a result of these negative experiences, it can be very difficult for trans people to find allies who will help them and care for them, whether that be in the formal system, like finding safe long-term care homes or home care services, but even in an informal way, finding friend and family carers. Some of the carers that we talked to said that they became carers expressly because they were allies, and in many cases were trans or queer themselves. We also saw that dementia can impact on people's ability to maintain their gendered appearance. So for example, no longer being able to shave or chest bind or wear their hair the way they want, So the difficulty maintaining these more outward signs of gender identity can put people at greater risk of cisgenderist violence if their outward appearance no longer matches, so to speak, normative expectations.
What are some of the areas that you think the field of gerontology should be focusing on?
I really believe that we need to continue to emphasize intersectional perspectives in gerontology, so exploring how ageism interacts with other oppressions like racism or colonialism or ableism, classism, to name just a few. There are so many older adults with multiple marginalized identities, and the discrimination that they have faced and continue to face has a very significant impact on the way that they age. Everything from their financial resources in retirement, their health status, or the possibility of accessing safe and culturally sensitive care, their social relationships, the list goes on. All this is on top of the pervasive structural ageism that is embedded, unfortunately, in every level of society and that older people have to contend with on a daily basis.
Thank you so much for sharing your important work with us, Dr. Silverman. We've learned so much today from your expertise, and thank you for taking the time to join us today.
My pleasure. Thank you so much, Nafissa.
Friends, thank you as well for joining us today. As you know, the Life Research Institute is dedicated to advancing research and disseminating knowledge about healthy aging. If you found this conversation interesting, please like, share, and follow us so that you can be notified every time that we post a new capsule. Don't forget to please also visit our website to learn more about our upcoming events. Together, we can help build a future where everyone has the opportunity to age with health and dignity. Thank you so much.